Susan Finley was just a worker at Walmart until she was laid off because she couldn't show up since her diagnosis with pneumonia. And subsequently, she couldn't maintain her insurance status, and to her son's painful memory, he remembers that my grandparents went to go check up on her to see if she was all right, and they couldn't get through the door. Once when the landlord opened, they had found that she had passed away. Now, this is a sad reality for many Americans today due to our flawed healthcare system, which is based on how well you can afford. Now, today I want to talk about the disparities in our healthcare system with our access to healthcare. I want to go into the impact, especially how it impacts people of low socioeconomic status, as well as some of its causes and some solutions worth mentioning. Now, lack of access to healthcare has been around for many decades, affecting mostly poor people of low socioeconomic status. Since Summers et al. Of the Millbank Quarterly in 2017 discuss that they forego treatment due to high medical costs. Now, they also have a higher rate of visits to the ER simply because they cannot obtain outpatient care at clinics due to not being able to afford these medical costs. So the situation becomes more dire when people succumb of their illnesses, just like of the first example provided by Santiago of The Guardian. Furthermore, he includes that there's a mother who in 2017 was diagnosed with ovarian cancer stage 3. Now, sad enough, she was also laid off from her work and couldn't maintain her insurance status. Eventually, she couldn't keep up with her medical expenses, and so by 2018, she couldn't pay for treatment anymore and discontinued and lost her life. With the United States being so advanced in its medical knowledge and technology, it is very sad to see that many patients cannot seek access to this treatment simply because they cannot afford it. Now, there are many causes to this lack of access to healthcare, one of them being the lack of insurance coverage. As mentioned before, people of low socioeconomic status are more burdened by this since they cannot afford insurance to cover their medical expenses, according to Lee et al. Of the International Journal of Equity and Health in 2021. And as a result, they cannot get the treatment that they need in a timely manner. Now, another cause is purported by many critiques of universal healthcare, especially from Goodman of the National Center of Policy Analysis in Dallas, Texas in 2005, and Singer of the Cato Institute of 2022, which say that countries that do have universal healthcare do not meet the demand of people since there are not enough medical resources and physicians to help them. So this results in long waiting times and not getting the treatment that they need. So this is another cause that they pointed out of the American healthcare system, because we too have shortages in medical resources and healthcare professionals. For example, Streeter et al. Of the Public Library of Science in 2020 mentioned that of the 3,000 counties that they had reviewed across the United States, most of them did not have a sufficient amount of medical healthcare professionals treating people. So this is another cause for for this complex issue here in the United States. Now, there are some solutions to a couple of these causes that I mentioned, as there are many. And one of them is to, on the federal and state level, increase spending on public insurance so that people who cannot afford it could get the treatment that they need. And this confers to better health outcomes for these patients, according to Summers of the Middle Bank Quarterly in 2017. And so we should be expanding public insurance. Also, another solution would be for healthcare providers to implement comparative treatment research. And this is a method that looks at which treatment is more effective and cost-effective for patients. For example, Sharon Begley, the Scientific American in 2011, mentions a research that happened of patients with hypertension that benefited a lot more from diuretic medication than other more expensive treatment that they could not afford. So it is important that these healthcare professionals make sure that they make the best decisions for each patient that is also cost effective for them. The last solution would be for the public to get involved. There are many public organizations that advocate for patients. As mentioned by Keller and Packo, the Journal of Health Politics, Policy and Law in 2014, since they interviewed about 80 patient advocacy programs, they said that most of them have some involvement and discourse with congressional members. So by involving yourself with these NGOs, you could definitely have an impact in public policy and have more worth for your say. For example, Christopher White of the National Catholic Reporter in 2022 mentions that the Catholic Health Organization, one of the biggest health organizations in the United States, actually had some influence in urging the Affordable Care Act to be enacted. So these organizations produce real results, and so it is worth becoming involved with them. So the lack of access to healthcare is a multidimensional issue that really needs to be addressed, and some of its causes can be amended for by increasing access to public health insurance, and also using comparative therapy research, as well as the public getting involved, not just in voting, but also in public health organizations. So I urge you all to help your fellow citizen in getting the treatment that they much deserve.